Greetings. Welcome to the presentation on mass casualty response and triage by Vermont EMS agencies and personnel. The purpose of this training is to outline the procedures and approach responding EMS agencies might use in the event of a mass casualty incident, whether it be at a school or other venue. Before talking about mass casualty incidents in particular, let's talk a bit about Vermont's EMS system. The system is comprised of approximately 180 different licensed EMS agencies, and they're roughly split in half between two types of service delivery. First response agencies are those that do not use ambulances and therefore do not transport patients to the hospital. They are your classic first responders who may respond from home, a workplace, or in some cases a station, such as a fire department, to render immediate life-saving care and stabilization. They then await the arrival of a transporting ambulance service. Transporting ambulance services own one or more ambulances and conduct the operations from point of contact in the field through transport of a patient to a hospital emergency department. Overall, we have about 2,800 licensed EMS personnel in Vermont. The graphic on this slide is meant to represent the relative proportions of personnel at each of our four EMS license levels. Starting at the bottom, we have two basic life support levels, the Emergency Medical Responder, or EMR, and the Emergency Medical Technician, or EMT. Above those, we have two levels of Advanced Life Support Provider, Advanced EMTs, and Paramedics. All four levels are capable of performing field triage in cases of mass casualty incident, and all four levels work together in concert to provide pre-hospital emergency care and transport of the sick and injured. From an EMS perspective, mass casualty incidents are often defined as the circumstances where the needs of patients, often in great numbers, surpass the available resources on hand to manage the incident effectively. For example, an EMS crew may respond to a single vehicle crash on a roadway and manage 2 to 3 patients effectively, calling in an additional ambulance as needed. However, if that same crash were to involve a passenger bus and multiple vehicles, they might be facing a circumstance with dozens of patients and simply not enough resources at the moment in time. They would request extra resources, but in a state like Vermont, that may take some time for them to all arrive. Very few jurisdictions have the ability to manage large numbers of patients simultaneously. From the EMS perspective, mass casualty incidents can also occur across a range of venues and settings and be driven by different factors, everything from a terrorist act to a chemical spill to a house fire and other types of mechanisms. The approach that leads towards triage involves changing the operational parameters of EMS personnel and begins to focus on the greatest good to the greatest number of patients. This involves assessing them and prioritizing for treatment. It's important to remember that mass casualty incidents at schools are relatively rare. An area of particular concern for the school setting is that of the active shooter scenario. In these cases, first responders must work together along with school staff and other personnel to effectively manage the incident and reduce potential harm and loss of life. A group of stakeholder experts was convened in Connecticut in 2013 following their own tragedies in that state. As a result of that group's work, a model for integrating first responders has emerged known as THREAT. THREAT stands for T, threat suppression, which is a law enforcement function, H, hemorrhage control, which is an emphasis on early management of critical bleeding by law enforcement or other personnel, R and E, rapid extrication to safety, A, assessment by EMS and medical personnel, including the school nurse, and T, transport to definitive care. The EMS approach to a mass casualty incident or other complex event is anchored at the principles outlined in the National Incident Management System. NIMS, as it's known, provides a framework for first responders nationwide to operate in the same environment with a mindfulness of safety and effective resource management. One of the tools in NIMS is the Incident Command System. EMS personnel could be assigned underneath operations in a particular branch or unit to effectively execute their tasks on a scene. EMS tasks, as we'll soon discuss, include everything from initial triage to patient care and eventually patient tracking and transport. In recent years, as part of trends more broadly in medicine and public health, EMS has been subjected to a focus on improving care through evidence-based practices. Part of a CDC project was developed to look at triage methods and assess their relative evidence base and try to come up with a set of best practices. As a result, a new concept and algorithm for triage was developed known as SALT. SALT stands for Sort, Assess, Life-Saving Interventions, and Treatment. This model has been promoted by the CDC as a new national standard and been endorsed by many key EMS stakeholder groups, including the large EMS physician oversight groups nationally. This slide depicts the overall SALT triage algorithm. We're going to break it down into a few different steps, but note that the two big areas of focus are global sorting and individual assessment. In the cross-shaped box are listed life-saving interventions. These are the particular skills and procedures that may be time-sensitive and therefore have been integrated directly into the assessment protocol. It's important to remember that the prioritization process outlined in the concept of triage is a dynamic process. After patients are initially categorized, there will be a need to go back and reassess and perhaps recategorize them based on changes to their clinical condition or based on the work that was done previously. Also, remember that resources available are constantly shifting in a large complex event like this. We want to make sure we're appropriately matching resources and using them efficiently to offer the greatest care to the greatest number of personnel. Going back to the threat model, it's important to remember that teamwork is a key principle in effectively managing these types of incidents. School nurses and others inside the building may be able to assist EMS personnel with parts of the triage algorithm, such as global sorting, which we'll look at next. Upon their arrival, EMS and law enforcement will then work together to achieve early, safe access to patients, to carry out assessment and transport. Going back to the SALT mass casualty triage algorithm, we're going to focus on step 1, global sorting. The goal of global sorting is to quickly prioritize patients for individual assessment. This will allow you to go first to those patients who are most likely to need immediate life-saving interventions, such as bleeding control. Global sorting is accomplished by a series of action steps. In the first round, as you approach a scene with multiple patients, you will give them a voice command. Something along the lines of, "Everyone who can hear me and needs help, move to the far wall by the exit door." Those who are able to get up and move are then grouped and will be the last priority for individual assessment. The principle is that these individuals are able to, under their own power, get up and move to a fixed location, demonstrating that their cardiovascular and neurological systems are intact. They may have injuries and will be assessed further down in the algorithm. The next action step in global sorting will want to identify non-ambulatory patients who can follow commands or are making purposeful movements. Again, by definition, these individuals were not able to get up and follow your previous command to move to the far wall by the exit door. By saying, "If you need help, wave your arm or move your leg and we will be there to help you in a few minutes," you are identifying this next group of individuals. Those who are able to move purposefully are prioritized second for individual assessments. The principle being that they do appear to have some neurologic and cardiovascular system abilities and would need eventual further assessment. As a result of the first two action steps, we are left in the end with three groups. Those that were able to walk and move to the fixed location will be priority 3. Those who were able to wave or make purposeful movements will be priority 2. All remaining individuals become priority 1 by default, those that are still and those with obvious life threats. These individuals are at high risk for having life-threatening injuries that require immediate stabilization, and therefore are prioritized first. Returning to our overall SALT mass casualty triage algorithm, after completing step 1, global sorting, we move on to step 2, individual assessment. For the most part, the individual assessment component should be left to the EMS personnel as they arrive on scene. One exception to this may be the principles outlined in the life-saving interventions box on the left side of the algorithm. Certain types of situations need to be rectified as quickly as possible by various personnel at various levels of training. For example, many people have taken a CPR course at some point in time and have learned how to open an airway, using either a head tilt chin lift or jaw thrust method. Controlling major hemorrhage, as mentioned earlier, is a topic of increasing focus among emergency medicine providers. Stopping bleeding early is an important skill and falls within both first aid and higher level medical care scopes of practice. Other critical interventions listed would be provided by EMS personnel only. As EMS arrives and applies their individual assessment portion of the SALT triage algorithm, they will conduct a number of assessments to identify where the individual falls in terms of overall prioritization. The categories are as follows: dead, expectant, which means that a patient may not be likely to survive given the resources we have available, but again, remember those resource levels change and this patient may still prove to be viable. Immediate, the patient is likely to survive if we apply resources to them right now. Delayed, a patient that does have injury and will need follow-up care, but can sustain for a period of time. And then lastly, minimal, either no injury or minor to the point where they may not be transported by EMS. As EMS personnel arrive on the emergency scene, it is important to attempt to provide a handoff of critical information. You should attempt to give a report on the incident details as you understand them, an update on any triage activities that have been carried out, such as global sorting, and any known locations of injured individuals. For nurses or healthcare providers operating in the school setting in particular, if they are able and willing, they should offer their assistance and request assignment to either the triage or treatment areas for continuing the work. It's also important for school personnel to gather and report out to EMS providers any medical information about individual patients, for example, medical histories of students or others. As we look ahead at optimizing the ability to manage complex mass casualty incidents in school settings, a few priorities have emerged. Jointly, efforts are underway to train and equip law enforcement with first aid practices that could prove most effective in the context of the triage methodologies used by EMS and also in protection of the public. In addition, EMS is going to work with law enforcement to integrate further into their response rather than stage in a safe location some distance away. This will take time and represents an evolution in the partnership between EMS and law enforcement specific to considerations of scene safety. Lastly, ongoing efforts will continue to assess the ability of schools to render immediate stabilizing first aid and also their overall abilities to plan, equip, and train their personnel to respond to these rare but critical incidents. This concludes our overview of EMS triage principles and practices, specifically as they relate to the school setting. For additional information about our EMS system, feel free to contact us at the Vermont Department of Health, and be sure to check our website at healthvermont.gov.